The abdominopelvic category is quite large and it contains many organs, so it is very helpful to divide it up into smaller areas for study. The medical scheme divides the abdominal surface and the abdominopelvic cavity deep to it into 4 approximately equal regions. These are called quadrants. So these quadrants are going to be named according to their relative position. That is, right upper quadrant, right lower quadrant, left upper quadrant, and left lower quadrant. Remember, when we use the terms left and right, we are always using the left and the right according to the person of interest. So over here we have the right upper quadrant and the right lower quadrant. And over here we have the left upper quadrant and the left lower quadrant. Not only do they divide this abdominopelvic area into quadrants, but regions. There are 9 abdominopelvic regions. These are the 9 abdominopelvic regions. The umbilical region is the centralmost region. It includes the navel, where the umbilical cord attached to the person during development. The epigastric region is immediately above the umbilical region. It overlies most of the stomach. The hypogastric region is going to be immediately below the umbilical region. It encompasses the pubic area. The iliac regions, which are both lateral to the hypogastric region, are named for their sides, and these iliac regions are going to overlie the superior parts of the hip bones. The lumbar regions, named for their sides, the left and the right lumbar regions, are going to be lateral or to the outside of the umbilical region. The lumbar region is between the ribs and the flaring portions of the hip bones. The hypochondriac regions are going to be lateral to the epigastric regions and named for the side of the body that they're on. These are going to overlie the lower ribs.